Hi everyone, welcome to my channel Made Pharma. In this lecture, we are going to cover the drug absorption. First of all, we will see the definition, then types, then factor affecting the drug absorption. Let's move to the definition. The first question is, what is the definition of absorption? Let's see. Absorption is defined as it is movement of drug from its site of administration into the circulation. Not only the fraction of administered dose that gets absorbed, but also the rate of absorption is important. Except when given intravenous, the drug has to cross biological membrane. Absorption governed by some of principles. Let's move to the types of absorption. There are three types of absorption. Number one, facilitated diffusion. In this point and the type of absorption, transporter belonging to the superfamily of solute carrier operate passively without needing energy, that is from higher to lower concentration. For an example, the entry of glucose into muscle and fat cells by the glucose transporter GLUT4. In second type, active transport. In this point, it requires energy inhibited by metabolic poisons and transports the solute against its electrochemical gradient, lower to higher concentration. For an example, levodopa and methyl-dopa are actively absorbed from the gut by the aromatic amino acid transporter. Active transport can be primarily and secondary depending on the source of deriving force. The third type of absorption is passive transport. It is the type of membrane transport don't require energy to move substance across cell membrane. Let's move to the next point, factor affecting drug absorption. There are various types of factors that affects the drug absorption. Some of them are as follow. First is aqueous solubility. In this factor, drug given in solid form must dissolve in aqueous biophase before they are absorbed. For an example, ketoconazole dissolves at low pH. Gastric acid is needed for absorption. Drug given as watery solution absorption faster than the same is given in oily solution. The second factor is concentration. Passive diffusion depends on concentration gradient. Drug given as concentrated solution is absorbed faster than from diluted solution. Third factor is area of absorbing surface. In this point, larger the surface area, faster the absorption. Vascularity of the absorbing surface. It is the next factor. In that factor, blood circulation removes drug from the site of absorption and maintains the concentration gradient across the absorbing surface. Increasing blood flow hastens drug absorption, just wind hastens drying of clothes. It means the blood flow increases, the absorption of drug will be increased. Then next point which affect on Drug absorption is route of administration, in that various types of routes are effects on drug absorption, like oral route, subcutaneous and intramuscular routes, topical sites like skin, cornea, mucous membranes, that are the factors which affects on the drug absorption. And with that, I wanted to thank you for watching. I hope you enjoyed this presentation and always stay tuned with us for more.